Hi, Dr. Bela speaking. This is the end of the year, end of 2021, which has been a very challenging year. And I thought it would be interesting and educational if I gave you a kind of a roundup, a summary, or take some takeaway messages of the 4 domains of my clinic, which is my skin clinic, my mole clinic, about Botox treatments and filler treatments. So thinking about my skin clinic, patients come with absolutely all sorts of different skin problems, but if I want to pick one common denominator, it would be the dry skin. So I think one of the most underrated daily skincare routine is moisturization of our skin, and I mean the body and the face, and mostly we are kind of good with the face, but we absolutely not good with the body. So each and every one of us should have a bottle of body lotion and a face wash and a face cream, and we need to use it every day because a well moisturized body and skin is much more resistant to all sorts of bacterial, fungal infections and allergies. So my number one takeaway message from my skin clinic is moisturize your skin much better, I mean your body and the face as well. The next one is my mole clinic, where patients come to check their moles, whether everything is all right. And of course I find a lot of non-melanoma skin cancers which are not life-threatening, but they have to be removed. And of course, every year I save a couple of lives by finding mostly early stage melanoma skin cancer, which can be sometimes challenging even for me to detect them, let alone lay people, because melanoma can stay under the radar for a long time because it's very, very slowly growing, and it's very difficult to detect any change in any of the moles. And although this image is not from this year, more precisely this image involves 3 years growth of a melanoma, but because I use this because it beautifully shows how subtle the appearance and the change of a melanoma, and how beautifully it can be removed surgically. But I need to emphasize here that the timely removal is paramount, because melanomas can spread beyond a certain point when it can be lethal. Definition of the screening is that you don't have any suspicion, you just show up and you have your moles checked. This is the best scenario when a melanoma is found like this, because when you don't see anything and the melanoma is found, it's most of the time the early stage. Who has to come for a mole check or a skin cancer screening? Someone with the family history of melanoma, or someone with high number of moles and or high number of atypical moles. Atypical moles which have asymmetrical border or shape, and asymmetrical or multiple pigmentation. Also, a useful term to know is the ugly duckling sign, which means if there is a mole on your skin which looks different from the rest of the moles. These lesions on the skin should be ugly ducklings, because each and every of them is a melanoma. So if you see anything like this on your body, you need to come for a checkup for sure. And interestingly, when melanoma comes, 70% of the times it comes as a new lesion. So not a change of an existing mole, it comes as a new lesion which appears on the skin from nowhere, and very slowly growing and changing, difficult to detect. Also, a takeaway message from my mole clinic is the importance of sun protection. Most importantly, avoid being burnt. And finally, that I tell to each and every patient of mine is the importance of vitamin D supplementation. So I personally don't agree with spending time in the sun to boost vitamin D production. I recommend being careful with the sun and supplement vitamin D orally. The next domain of my clinic is the aesthetic clinic and Botox treatments. Interestingly, Botox is a very confused term. Even journalists don't take the time sometimes to understand what Botox is and what the difference between Botox and fillers, and whatever they write and usually whatever goes wrong, they put under the umbrella of Botox. In reality, Botox is a very straightforward, very safe treatment, which is mainly for the relaxation of the muscles in the upper face, so they smooth out lines and they prevent deepening of lines. It can be used to soften the masseter muscle, which helps grinding, and also it can be used for to treat excessive sweating. A typical complaint how patients come to me with Botox, just to understand it better, is they're telling me, Dr. Bela, I'm a happy person, but my environment, my family, my friends sometimes comment on me why I'm so crossed all the time. And this is because looking crossed is because of the frown lines, the deep frown lines, which send out the message of anger, and independently from your mood or state of mind, this is a constant message of being angry. And you can be a happy person inside, doesn't matter, when you send out the message of anger, and this is what your family and friends detects from you. So this is why I believe these facial aesthetic treatments are much more than vanity. They have a very important psychological aspects as well. They can improve quality of life. And finally, the fourth domain of my practice are soft tissue fillers. Due to the normal aging process, we lose volume from our face, and with these hyaluronic acid fillers we can beautifully replace the lost volume. We can build projections, we can give a so-called liquid facelift. Fillers are completely different from Botox. They have a different risk profile, and they involve much more planning and a little bit better understanding of the whole process. So it's really crucial before having Botox or mainly fillers, you have to have a facial aesthetic consultation with me or with another aesthetic practitioner to really understand the subtleties of filler treatments. And I would like to share with you a very interesting case from this year. This lady, and the whole story can be found in my blog in details. This lady went to someone in the city, and she was a nurse, an aesthetic nurse, and she performed the treatment on her using the wrong product, using wrong technique, and putting a wrong product with wrong technique into the wrong place. And she came to me after this in desperation to help her. And what I needed to do, first of all, to highlight all the fillers from her face. And once it's been done, I started to build up her face from scratch. So at this picture, you can see on the right hand side, you can see after I put 3 syringes of hyaluronic acid, so soft tissue fillers in the cheeks, and 3 syringes in the chin. So on the left hand side you can see the original with the big sausages close to the nose, and the middle picture shows after the Hyalase treatment, the removal of fillers. And finally on the right hand side you can see after me putting in fillers into the cheeks and chin area. And finally you can see it, the same 3 images on the oblique view. You can stop the video now if you want to have a look at the images for a longer time. And finally, a very interesting thing from my filler clinic is the pressure that patients put on me. Dr. Bela, please put 1 or more syringes here and there. And I need to have a look at their face with an artistic kind of eyes. And I refuse quite a few £1,000s worth of treatments every month, so I leave a lot of money on the table, because it wouldn't be appropriate to put those syringes that patients ask for into their face, because it wouldn't be natural, it wouldn't be normal. So I'm always shocked when I see pictures like this. This is a 23 years old woman who has gone through this transformation, which I deem terrible, and honestly I don't understand the medical doctor or the team who did this, because it has to be a mutual responsibility. And when a patient comes to me or comes to a medical doctor with a request like this, we need to kind of counsel that patient, and we need to send her to a psychiatric or psychological treatment if they have aspirations like this. And the next image, this young lady who says she likes these cheeks, which are absolutely abnormal, and there shouldn't be any doctor or nurse or dentist or whoever who is willing to do such a terrible thing. But going back to fillers, fillers are my #1 favorite treatments if you ask me. I do a lot of filler treatments and patients are very happy, and I can deliver a lot of value by these treatments. So that's it really. I hope you find it useful and interesting what I have just shared. You can find more information on my website, which is drbela.clinic. You can book most of the treatments appointments online from my website, and I thank you for watching, and I wish you Merry Christmas and a prosperous 2022. Thank you very much. Bye for now.